With that, we will now move to the second item on our agenda for today, which is the State Auditor's Office performance audit on contracted homeless services. And we have quite a few people who are online to offer comment and answer questions, and I will hold our committee questions till you've had a chance to offer your comments, and then we'll open it up for committee questions. So welcome to our state auditor's staff in person, and please introduce yourselves and take it away.
Thank you. Good afternoon, Mr. Chair, members of the committee. My name is Shauna Good, and I'm a Principal Performance Auditor with the Office of the Washington State Auditor. With me today is Sohara Monahan, who was the lead on the audit that we're presenting today. This audit was designed to identify opportunities to improve how local governments prioritize contracted homeless services and manage provider performance. Before we begin, both Sohara and I would like to thank the management and staff at the 4 local governments that we included in this audit for their cooperation and assistance throughout the audit. The 4 local governments included in this audit were the City of Seattle, the City of Spokane, Snohomish County, and Yakima County. We selected these governments based on factors such as the number of people experiencing homelessness, government's spending on homeless services, and stakeholder concerns. I'll start with a brief summary of our key audit results. We found that governments can improve how they prioritize the homeless services they procure by implementing a data-driven process that would help them identify and quantify unmet needs for people experiencing homelessness. Although audited governments generally contracted for homeless services they set as priorities in their strategic plans, some invested little in permanent housing solutions. Audited governments can also improve how they evaluate and monitor service providers' performance by making better use of data. And finally, we found that governments should be more consistent in addressing poor provider performance to help them improve and achieve better outcomes. We did this audit because homelessness continues to be a complex and growing concern in Washington. Local governments are spending more to address homelessness, but despite that increased spending, the number of people experiencing homelessness continues to grow. From fiscal year 2018 to 2021, statewide spending in homelessness, including federal, state, and local dollars, grew by about $100 million. The number of people experiencing homelessness grew by about 600 from 2018 to 2020, which was the most recent count available during our audit. The annual point-in-time count was not conducted in 2021 due to the pandemic. While several factors outside local government's control contribute to increases in homelessness, stakeholders think governments could do better prioritizing services and managing provider performance to improve outcomes. We conducted this audit to examine how select cities and counties could improve processes for identifying and prioritizing the homeless services they procure. We also sought to determine how they could better manage the performance of the providers they hire to address the needs of people experiencing homelessness. Along with permanent housing, people experiencing homelessness have a wide range of needs. In Washington, local governments are responsible for identifying needs and determining which needs are the highest priority for funding. They're also responsible for managing the performance of the service providers they hire to address these needs. Some local governments have specific departments and homelessness boards that help them develop strategic plans, identify needs, determine funding priorities, and procure homeless services. Federal and state agencies, such as the Washington Department of Commerce and the U.S. Department of Housing and Urban Development, provide guidance and funding to help local governments address homelessness. Federal guidelines recommend that governments establish a data-driven process to prioritize service needs for funding. Comparing the homeless services people need to services available in a community can help governments identify and quantify unmet needs for specific services. This analysis can also help governments better prioritize limited funding for the services that are most needed to address homelessness in their community. We found that most audited governments lacked a data-driven prioritization process to identify and address unmet needs. While they collect some data that could be used for this purpose, most are not analyzing the data to identify unmet needs and determine funding priorities. Instead of making data-driven decisions about which homeless services to fund, audited governments often based funding priorities on grant requirements, consultation with homeless boards, and requests from elected officials. Decisions about which services to procure are also part of a political process involving different branches of government. For city governments, mayors and city councils have final decision-making authority around which homeless services to fund and have at times chosen to fund different services. For example, the City of Seattle Homeless Program planned to increase its investment in permanent housing solutions, but the mayor and council reprioritized the funds to instead spend more on shelters. Sometimes it's appropriate for leaders to make decisions that don't align with what the data supports. Even with a data-driven process, sometimes circumstances may change abruptly and elected leadership have to make a call. But if this happens regularly, it's no longer a data-driven process. I'm now going to turn the presentation over to Sahara, and she'll go over the rest of our findings and recommendations.
Thank you, China. State law requires that local governments develop a 5-year strategic plan to address homelessness. In these plans, governments set goals that outline the services they plan to provide to address homelessness in their communities. We found that the audited governments generally contracted for homeless services that aligned with their strategic plan priorities. From 2017 to 2021, the 4 audited governments spent about $459 million in contracted homeless services such as permanent supported housing, outreach, and shelters. Experts recommend that governments invest in permanent supported housing solutions to help reduce homelessness, because this approach can help provide people with a stable home and the social supports they need to address issues that may have contributed to their homelessness, such as unemployment, substance use, or mental health. Our audit found that the City of Spokane and Snohomish County have made larger investments in permanent supported housing solutions over the last 5 years. However, the City of Seattle and Yakima County have invested more in temporary solutions. As the blue line on this graphic illustrates, Snohomish County consistently spent about 60% of its homelessness funds in permanent supported housing over the last 5 years. Similarly, the City of Spokane significantly increased its investment in permanent supported housing since 2019. In contrast, the City of Seattle has invested far more on shelters. The city's homeless program had planned to increase investments in permanent supportive housing. However, program management said that the mayor and city council, who have final authority on how to use homelessness funds, chose to spend more money on shelters to address immediate needs rather than prioritizing investments in permanent supportive housing that can help move people out of homelessness. Yakima County Homeless Program invested most of its homelessness funds in supported services such as counseling and resume writing. The county homeless program had also planned to increase investment in permanent supported housing solutions. However, the program director explained that very few providers applied to offer this service. Additionally, the director explained that limited local funding contributed to lower investments in permanent supported housing. Experts recommend that governments collect and use performance measures data to evaluate and monitor the performance of their service providers. Performance measures offer governments consistent standards by which to measure the progress their service providers are making in meeting key goals that are intended to move people out of homelessness. Our audit found that all audited governments collect performance measures data on key metrics. However, not all of them use the data to assess provider performance. As this table illustrates, some of the audited governments were not using the performance data to assess the progress their service providers were making in meeting key goals intended to move people out of homelessness. They were not using the performance data, the performance results to discuss results with providers and formulated strategies for improvement. And most audited governments were not using performance results to inform decisions about which providers and programs to continue funding. The reasons why governments did not follow the leading practices for monitoring varied. The City of Seattle Homeless Program had limited authority to use performance results for corrective action. If a provider was underperforming, for example, program staff could provide technical assistance and issue a corrective action plan. However, if the level of underperformance required more stringent measures, such as cutting funding or terminating the contract, program staff needed the mayor's approval, which in some cases it wasn't granted for other considerations, affecting the program staff's ability to hold poor-performing providers accountable. The City of Spokane Homeless Program experienced high turnover in staff and director-level positions over the last 5 years. It also had some technology issues that prevented the production of performance reports that staff needed for monitoring performance. Yakima Homeless Program was fairly new and had limited staffing available who were prioritized in the response to the COVID-19 pandemic. Governments spend millions of dollars in hiring service providers to deliver services that are intended to move people out of homelessness. Therefore, it is critical that governments take appropriate corrective action when providers are not meeting set goals. We reviewed a sample of underperforming programs for each of the audited governments, and as this graphic shows, we found that the audited governments had not taken corrective action to address poor performance for most of the underperforming programs that we reviewed. These were programs that had consistently not met performance goals on key measures such as moving people into permanent housing, reducing the length of time people stay in a homeless program, or maximizing program use. Several factors affected government's ability to hold providers accountable. Some of the audited governments were not using performance data to identify which homeless programs were underperforming. All audited governments lacked adequate processes to correct poor performance. For example, they did not have a schedule of corrective actions they will take relative to the degree of underperformance. They didn't have a tracking tool to capture and review the actions they have taken to address poor performance. And they lack language in their contracts requiring providers to submit an action plan outlining the steps they will take to improve performance. As previously mentioned, some governments experienced high staff turnover and limited staffing, which affected oversight. And last, government staff share a perception that external factors such as the limited supply of affordable housing and few providers hinders their ability to hold providers accountable. We acknowledge that external factors may make it more difficult for service providers to achieve goals. However, we believe that taking appropriate corrective action to help to help providers gradually improve performance is feasible and necessary to help reduce homelessness. Governments can start by providing technical assistance and requiring providers to submit an action plan that outlines the changes, the steps they will take to improve performance. If poor performance persists after a set date, governments can take other measures that experts recommend to compel improvements, such as revising the programs, reallocating funds to the higher performing programs a provider may have, suspending payments, or cutting the amount of funding a program receives. We made several recommendations to 3 of the 4 audited governments to help them better prioritize the homeless services they procure and better manage provider performance. We did not provide recommendations to the City of Seattle because now the new Regional King County Homelessness Authority manages the homeless program for the region. A full list of our recommendations is in our audit report. This is a summary of the recommendations. We recommend that local governments develop a data-driven process that compares the services people need with services that are available in the community to identify unmet needs and determine which unmet needs are the highest priority for funding. We recommended that governments address the causes we identify for inadequate oversight of their service providers. And finally, we recommend that governments implement the practices we identified to strengthen monitoring and to more consistently address poor provider performance. This concludes our presentations. We can take any questions you may have at this time.
Thank you very much. Before we go to questions, I'd like to ask if the reps from the cities of Seattle, Spokane, Snohomish County, and Yakima County would like to offer any commentary. And if you would introduce yourselves online, whoever would like to jump in first. Looks like Mary Jane Burrell.
Thank you very much, and thank you to this esteemed committee for giving us an opportunity to comment. I'd also like to thank the auditors for their work here in Snohomish County and their efforts to understand the system and ask very deep and thoughtful questions and make recommendations. I'd also like to point out the auditors acknowledged a number of ways in which Snohomish County is operating an effective homeless housing system, and the county certainly appreciated that acknowledgement. That we do make major investments in permanent supportive housing and other permanent housing solutions, that the county follows the leading practices for monitoring provider performance, and that it involves management of the review of performance, uses data to monitor that performance, and communicates performance results to providers. The county agrees that it can more fully document the technical assistance and other actions it takes when a contractor is underperforming, and we have begun implementing the recommendations of the auditor's office in that arena. It's important to include in this process a method for ensuring that individuals being served by any underperforming contractor are not harmed during the process, which is our first consideration, making sure that the people we're serving do not have a break in service. And so in general, we take those actions at the end of each contract cycle, but we agree that we could, in some instances, look at that during a contract cycle. I will say that 2 years of this 4-year audit period were during the COVID-19 pandemic, and many federal funders, for example, suspended performance requirements during that period in a recognition that there were significant challenges with just keeping services going forward and addressing the needs of the people who are served. The auditors also noted that Snohomish County uses and documents the use of performance data on a consistent basis to determine which projects to continue funding, and that Snohomish County trains contract management staff on how to manage contractor performance. We also agree that with their recommendation that we could do more to document our process curriculum, learning objectives, and training materials that we utilize in that process. We have some more detailed comments regarding how we determine and fund needs and the context for taking active corrective action on provider performance. And we are planning to submit that for your consideration in a more comprehensive response. I also wanted to point out that since the pandemic began, Snohomish County has ensured housing stability and prevented homelessness for more than 16,000 households through the provision of rental assistance, significantly increased our shelter beds, placed more than 500 households into non-congregate shelter, and transitioned more than 1,600 households from homelessness into housing. We have been able to achieve those results during the most challenging public health crisis in a century with the support of the Washington State Legislature and some of the significant tools you have given us over the last few sessions to address these persistent challenges, and we greatly appreciate that help and support. We also appreciate that the legislature recognizes that we are facing a challenge that has been decades in the making and working with us to ensure that we address it as quickly as possible. That concludes my comments. I'd like to thank you for your time and consideration.
Thank you for offering those comments for Snohomish County. I had seen Jennifer Saracidis from City of Spokane had lit up. Did you want to offer any comments, or Michael Bailey for City of Seattle and Esther McGeesus for Yakima? Jennifer?
Yep. Hi, this is Jennifer Saracidis, City of Spokane Community Housing and Human Services Director. Thank you for the opportunity to speak today. We really appreciated the feedback and the recommendations that we got from the State Auditor's Office through this process. As noted in the audit review, we were heavily impacted by staffing challenges. And we have remedied that at this point with, we're up to being fully staffed. I just made the last offer today. So we're really pleased to be able to get back up to speed and making, putting into place all of the recommendations that were made to us. As noted, we have made in our community some significant investments into permanent housing, which we're really proud of. We do struggle to balance that with the needs for emergency shelter, especially given the weather that we have over here on the west or on the east side. Right now, we're in a heavy snowstorm, and dividing that, you know, the resources that we have between permanent housing and shelter housing is always a challenge. We also have looked at some of the performance measures that we were unable to report on due to performance measures being made without consultation of what our system was able to capture. And we're rectifying that to make some adjustments to make sure that the performance measures that we want to capture are able to be captured utilizing the system that we have. So thank you for your time today, and we appreciate all of the work of the State Auditor's Office.
Thank you. And Mr. Bailey, would you like to offer comments on behalf of Seattle?
Certainly. And good afternoon, Chair Pollitt and Vice Chair Wilson and members of the committee. For the record, my name is Michael Bailey, and I have the privilege of serving as the Deputy Director here at the Seattle Human Services Department, otherwise known as HSD. HSD serves as the convener, funder, and direct service provider for the City of Seattle's many human service investments. I'd like to thank you for the opportunity to provide brief testimony to the State Auditor's performance report on contracted homelessness services. We also want to thank the State Auditor and her team for their work on this report, its findings, and recommendations. As you've heard, the report examines a portion of the city's efforts to address homelessness under the previous mayoral administration. As the city was transitioning through administrations, the city also transitioned management of its homelessness service provider contracts to the newly established King County Regional Homelessness Authority, also known as KCRHA. On January 2022 of this year, the Regional Homelessness Authority took over the contracts and assumed responsibility for developing, communicating, and executing the regional strategy to end homelessness. We recognize that ending homelessness and providing affordable housing remains a top priority for the new mayoral administration. Mayor Bruce Harrell, who took office this year, recently allocated over $100 million towards homelessness response efforts as part of his proposed budget. And in addition to the HSD investments captured in the report, I'd like to note that the Seattle Office of Housing, which is a separate city department, made additional investments towards housing. We know that access to housing is both a symptom and a solution to the homelessness crisis, which is why the Office of Housing invested an additional $209 million towards housing individuals exiting homelessness. Additionally, the Harrell administration supports the state auditor's recommendation to provide stronger and data-informed supports to the providers in this field. Earlier this year, the City of Seattle released the Homelessness Action Plan, which hosts a public-facing dashboard that features previously unreleased data on the city's progress towards ending homelessness. HSD plans to continue working in partnership with the Regional Homelessness Authority to improve monitoring and data collection, particularly as the Regional Homelessness Authority begins to rebid their homelessness contracts. In closing, the City of Seattle would like to thank you for the opportunity to continue the conversation around ending homelessness here in Seattle and in the state of Washington. We're happy to take any questions, but just wanted to acknowledge the amazing work done by the State Auditor's Office and her team.
Thank you. And we have in person, Esther, you'll have to pronounce your name for me. Thank you.
It's a Magasis. I always tell people a magazine about sisters, Magasis.
Okay, Magazine Sister, Magasis from Yakima County. Welcome. Thank you for coming in person, and please take it away.
Yeah, thank you so much, committee members, for letting me come and present, and thank you to the State Auditor's Office folks. I want to say that the process working with Sahara and her team, I thought went really well. Sahara spent a lot of time getting to know the work, the community, asking us questions, following up, and also explaining the process to us really succinctly and clearly. So I just really want to take time to say I appreciate working with the State Auditor's team. Yakima County, as was noted in the presentation, I don't know, since I'm here and I don't have to be on the screen, I don't know if it's possible to throw up one of the slides again. Exhibit 7, which was our level of expenditures, I think if you go to, I'm not sure which slide it was, but thanks, Zahara.
I think this is it.
Perfect. So I just did want to provide a little context to this slide, and I think looking at the other counties that were represented, I realized that I should have provided this context during the review period, but the supportive services line is pretty varied, and it does contain all of the other services that were in the more sort of differentiated lines of the other reports. So we do have rapid rehousing, shelters, transitional housing, outreach in that single supportive services line. So I just wanted to provide a little context to that graph because it does look very stark that we have at almost 100% one category and then a very low amount everywhere else. It is a little bit more differentiated that all of our programs got put sort of into a binary of permanent supportive housing or not permanent supportive housing in the way that it appeared in this graph. Another thing I wanted to draw attention to in this graph was just that we have only 2 years as opposed to the 5 years that the other communities had in their audit. The reason for that is that Yakima County has been going through a lot of changes at the local level. The homeless program was previously overseen by another entity and only came to Yakima County in 2019, in July of 2019 at the change of the fiscal year, which means that our audit period was a little truncated. It's also impacted a lot of the work that we've done. The Department of Human Services, which I oversee, which the homeless program is a component of, was formed January 1st, 2020. We had planned in January of 2020 to take the ball and have the newly formed department and this new program and just take off running, clean up the data, all this other stuff. And we had some unexpected plans in 2020 that came our way, same with everybody else. So our department ended up taking the lead on a lot of the COVID response, specifically emergency housing and shelter response. And so that's another component of that large supportive services line you see, a lot of that was rental assistance, shelter grants, hygiene products for shelters, and as Sahara mentioned in the presentation, that was a big reason that just proportionately a large amount went to other funds. We don't have a ton of funding in our community. The two primary funding sources for homeless services are the Consolidated Homeless Grant, which comes from Washington State, and then 2163, which are our local filing fee revenues. 2163 allows us some flexibility. Consolidated Homeless Grant, which is usually the majority of our funds on any given year for homelessness, really doesn't offer that same flexibility. The funding categories are prescribed to us through the grant by the state, and so the majority of that fund goes to rapid rehousing rental assistance, which for us is captured in that supportive services column. The permanent supportive housing funds, I do think that Yakima County could invest more in permanent supportive housing through our 2163. It's a relatively small amount that we get in 2163, especially compared to some of the other communities in this audit, like Seattle. But I do think that there is room for flexibility and for change there, and for there to be an increase in investments in permanent supportive housing. But the majority of our other funds, we don't have that same flexibility just because of the nature of the funding. And then I would just say that a lot of the work that we've done to build the department has been towards meeting the goals of what the state auditor's report laid out. This was actually a really helpful process for us being a new department. I kind of have described it as getting to see the teacher's key as you're taking the test. Since we're building the department, being able to go through a program audit like this gave us a chance to really get really helpful feedback for us to implement going forward and integrate into our processes and policies as we develop them, instead of having to kind of rework something that exists. So you'll see that this audit process ended in 2021. Our hire who oversees the homeless program currently started in September of 2021. So it gives you a little bit of an idea of the newness of our department and the capacity building we've done since then. We've added multiple positions and are planning on making investments in more positions to build capacity in the new year. Since even the period that was audited, we've added a lot of policies and procedures, and I'm excited to be able to take the feedback that we received from this audit and continue to build that as we hire on more staff and grow the department. And if you've got any questions, please let me know.
Thank you very much. Thank you for joining us in person today, and for your openness to use the audit process as it was ongoing and you're building a program. Thank you. I'd like to kick off the questions with one for the State Auditor's Office staff. And some of this may be because just me needing clarification. A significant portion of the programs relating to homelessness and housing overall are funded via the state. And as was just mentioned, State Department of Commerce grants. And I'm wondering if you looked at what the state and DOC's role should be in ensuring that its grantees include in contracts the things that you recommended for cities and counties to have in their contracts, like performance improvement or corrective action plans.
Because this audit concentrated on evaluating the local government processes and what they can do to better manage performance, we did not examine Department of Commerce role. But like you said, Department of Commerce administered the Consolidated Homelessness Grant, and a lot of the local governments received this grant, so they could potentially play a role in ensuring that the local governments are including the performance measures in contracts and targets, but they were not included on this audit.
Is that something that the State Auditor's Office might, have a sit down with Commerce to discuss these recommendations and how Commerce could? It seems to me across the board, many of these recommendations could apply just as easily to Commerce as to the city itself. Is that something? Maybe if you're not prepared to answer it, let me just put that out as a recommendation that you might sit down with Commerce about the results.
Yeah, I guess I would just say that we're certainly open to that. I know Sahara and the team had conversations with Commerce during the audit, so I think that would be something we could do.
Yeah, absolutely. We talked to them during the scoping and planning efforts, and currently they see the role more as of a guidance role rather than an enforcement role. So definitely is a potential good conversation to have with them. But like I said, they were not part of the governments included in this audit. So
I suppose one might say that the cities and counties saw their roles more as a guidance role rather than accountability role too, is the finding of your a central finding here. For the record, I want to make sure that the record recognizes that Representative Gaynor joined us quite a while back in the meeting, but I forgot to make sure he was noted then. Thank you. And are there other questions? Representative Orcutt.
Thank you, Mr. Chair. So I'm kind of looking at the graph that was just up there, actually, for Yakima. And I look at, shelters for youth and adults, and I look at permanent supportive housing, and I feel like I've kind of got a pretty good idea of what those are and what forms those would take. What I'm a little less certain about is some of the supportive services. And so I was wondering, Ms. Magasis, if you could give us some indication of what some of those supportive services are. I heard the term contracting out, who you're contracting with, and is there, and if you could talk a little bit too about the short term, the here and now supportive services versus the long term, helping them get from shelters to supportive, long-term housing, whether it be supportive or self-sustaining. So if you could give us a little more information there, and some examples maybe of what some of those supportive services are.
Yeah, of course. So in our community, within the supportive services bucket, you see a sort of everything along the spectrum. We kind of, in our community, talk a lot about the spectrum of the homeless response system, starting at an engagement level with people experiencing street homelessness. And so that would be outreach teams who go out and try to engage with individuals who are in potentially unsanctioned encampments, living in the street, or in places not meant for human habitation. Those outreach services are covered within supported services. We do offer outreach services. When you made a note of me saying that we have contracted services, the department at the county doesn't provide any direct services ourselves. We contract for all of our services. Part of the reason behind that is just we want to make sure that we are working with folks who are able to specialize in those areas, and also we want to be able to sort of stretch the tax dollars that we have to invest. As I said before, Yakima County doesn't have a huge amount of funding compared to some of the other communities across the state in our public sector, and so being able to contract out for services allows us to pair public dollars with private investments, grants, donations, whatever else it is that nonprofits are able to bring in as resources to our community. So all of the services I'm going to list are contracted out. Yakima County does provide limited services in some of our other fields like veteran support, affordable housing, but not within our homeless response system. So when we look at the homeless response system as a whole and think about that entry level where you're engaging with people in street homelessness, outreach services are funded. They then ideally will be able to, if outreach is successful, you'll transfer individuals from street homelessness into shelter and engage them with services there. Shelter services are also funded under the supportive services, and so that could be bed nights, food, case management. From shelter services, we hope to see that they're using that as a platform to get stability and to be connected to other organizations that can provide services like rapid rehousing to help transition people into housing by paying for first and last of the rent, first and last of the month, a few months rent to stabilize them, down payments, whatever else it is that they need to to cover move-in fees into a housing complex. So rapid rehousing is a component. We have some medical respite services, which I think are actually a little bit unique to our community. It's another form of low barrier shelter, but it's actually intended to be for individuals who are exiting medical care but are not in a condition that it would be safe for them to return to a shelter, a congregate shelter. And so we do have some medical respite services, or for individuals who might be coming in off the street with a medical issue that's severe enough that it requires additional assistance, but not severe enough that it requires hospitalization in an emergency room. We also do some transitional housing and domestic violence services and shelter support as well. So those are sort of our major categories.
Thank you, Mr. Chair. So can you talk a little bit about some of the services that you're contracting with? First of all, are they with nonprofits? Are they with a community college? Are they with private businesses? And what are those that are trying to get them into long-term self-supportive housing, such as improving education, job training, life skills, that sort of thing? And then, what kind of services and how much of the services you're providing are drug and alcohol and mental health services?
Yeah, so we contract, I think, pretty much exclusively with nonprofits in the community for our homeless response services. We do work with the schools. We don't have funds going towards the schools, although in our community there are homeless dollars that go to schools through McKinney-Vento and YHDP, which is the Youth Homeless Diversion Program, I believe. The name might have changed, or it might have changed to YHDP. We've got a lot of acronyms in the homeless world. So we do have homeless funds in the educational system, not coming through our county, and they weren't included in the audit. We also work with schools in the context of trying to, we're an anchor community. I don't know if you're familiar with Anchor Community Initiative. It's a Washington State initiative to end youth and young adult homelessness. It's through the Washington State Office of Homeless Youth and Away Home Washington, which is a nonprofit in Washington State. So we were one of the first anchor communities. There are 4 initial anchor communities, ourselves, Pierce County, Walla Walla, and I want to say Spokane, and I believe they just added 4 more. So we do have a lot of work specifically around youth and young adult homelessness. Part of the reason for that is we are a disproportionately young county. I believe the 38% of our population is under the age of 25, qualifying them for youth and young adult services. So we do work with schools pretty extensively on a systems level, trying to coordinate, trying to create systems of referrals and support. We just are not funding them through the county programs. We fund programs at Triumph Treatment Services. We have a family shelter that we fund there, and Triumph Treatment Services does do drug and alcohol support as well. We aren't funding explicitly drug and alcohol programs. We're funding the shelter component of that. Similarly, I think Catholic Charities is another program that we fund, and I believe they do some substance use work. We're not funding their substance use work, but we're funding the housing component that they use in their wraparound services. Yakima County did recently pass a mental health sales tax, though, and so we've been working on developing reports and research around the best way to invest those dollars. And so I'm hoping that in the next year we will have more funds going out in the substance use and behavioral health fields as well.
Let me just see if the city of Seattle or Spokane would like to offer a view on the similar services they're providing, or Snohomish. Mr. Bailey, go ahead.
Certainly. Just want to chime in here. With our services now existing with the Regional Homelessness Authority, it would be more appropriate for them to provide an overview on how they plan to leverage those services moving forward. We're happy to take that question back and perhaps get a response back to JLARC staff if you deem that necessary.
I think it would probably be helpful. Thank you. Ms. Saracides?
Yes, thank you. And just to clarify, the original question was what services are being provided and by whom?
Yeah.
Yes. Okay, great. Thank you. So we contract with a variety of subrecipient agencies in Spokane, primarily nonprofits, although we do have a few for-profit companies that we connect with. And the services that we offer are wide-ranging. We have emergency services that are really geared toward keeping people safe and alive, emergency overnight shelters, winter shelters, et cetera. We also are involved, similar to Yakima County, with the Anchor Community Initiative. We were a founding community in Spokane, one of the first 4. And we did just start our youth homelessness demonstration project, which is a demonstration project through HUD that's geared at serving youth, really trying to stem the tide of folks that are homeless as youth typically have more chance of becoming homeless as adults, so that if we can get their services and get them situated early on, that they're less likely to fall back into homelessness. Housing has been a real challenge for us. As I'm sure it is across the state with rising prices. So even with the services that we have available, if someone has a voucher, they have a case manager, we're still struggling to get folks into permanent housing just due to the low vacancy rates that we currently have in Spokane. But overall, similar services to what the Yakima representative discussed.
Thank you. And Ms. Burrell for Snohomish.
Thank you for the question. Yes, Snohomish County spends its housing dollars first and foremost on housing. And we look to other mainstream systems to provide the other services that are needed, largely the same behavioral health services, transportation, childcare. There's an array of services. We use something called the Fenn-Jorsted Matrix, which covers about 16 different life domains in which people may need services. We do reserve a small portion of the housing dollars in what we call a flexible fund. There are sort of 2 different ways you can approach the provision of services for unmet needs. One is to say, at a systems level, we're going to fund contractors to do that. The other is the one that's been adopted by Snohomish County after years of exploration, which is at the individual level, so that a helping professional working with an individual experiencing homelessness does a thorough assessment of what are all of their needs and and areas in which they have needs. They look first to the mainstream systems. Are they eligible for your service? If they need that service now, when might that service become available? And that flexible fund is used on an individual basis when we're not able to access mainstream services to help to buy services on the open market for the individual to be able to receive those services just in time and continue moving forward on their personal plan. So it's a different approach. We find it to be a more flexible and responsive approach, and one that is more client-centered and strength-based. We do have contracts with a number of community providers, and we have contracts with both private, nonprofit, profit, for-profit, other governmental contractors, including school districts and institutions of higher education, to provide services, but we do not do that with homeless housing system dollars. We have taken this flexible, individualized approach. I will add that during the pandemic, we could not have moved, our partners could not have moved anywhere near as quickly and nimbly as they were able to move had we taken that systems rather than flexible fund approach to addressing this issue, which is significant. In terms of the question of employment services and those services which help transition people to permanent, for lack of a better term, self-sufficiency, we operate on a 5-pillar theory of action, which starts with having a coordinated point of entry where you can assess all of an individual or household's needs. What they need are preventive services, providing those first, because it's a lot less expensive to provide prevention services than to serve people once they have actually become homeless. For people who have become homeless, getting them into housing as quickly and rapidly as possible is the next pillar, and then providing tailored services that's individualized to the individual household's needs. Again, we found a flexible fund approach much more productive for doing that. It is data-driven, but it is more productive than contracting out those services with homeless housing system dollars. And then the fifth pillar is providing people access to economic opportunities. And that is, again, primarily using additional mainstream system resources. We have also had a number of foundation resources where we could test new models. We're currently using surge funding that has been available during the pandemic to strengthen some of those programs and people's access to higher education. Well, both for households with children in schools, providing those services in schools and with institutions of higher education, the workforce system, the basic food, food employment and training system, the workforce system, and other systems that are providing some of those services. So that a lot of what our staff are doing are helping bring those services together in an individualized plan of action for a specific household to meet their needs.
Thank you all for giving those reviews. It's much appreciated. And do we have any final questions? I just have one additional question. This obviously is an issue that isn't going away. Does the state auditor's office plan to do a follow-up or on adoption of recommendations or any additional follow-up? And I'm also curious as to including the King County Regional Homelessness Authority in review.
Actually, I would respond that at this time, we don't have any specific plans to do a follow-up in this area, but we have had conversations just as a team about how this is a complex and ongoing issue. So we think that it is likely that at some point we will be doing some follow-up work on this topic.
And just to add, even though right now there is no plans for another audit on homelessness, the performance audit program does follow up once a year with the governments that we have audited to check on the status of the implementation of recommendations.
So when you do that, I think it would be great to have the follow-up represented to this subcommittee. I think for King County members, we might be interested in seeing if King County Regional Homelessness Authority is willing to respond about what it might be doing to follow up, rather than just saying we're brand new and the city of Seattle saying, well, we passed it off to them. So is that feasible that the follow-up in a year could be shared with the committee?
I think we'll have to talk to our directors about that and come back to you. Scott Frank is here.
Put you on the spot, Frank.
I'll just kneel here. Thank you. Scott Frank, the Director of Performance and IT Audit for the Washington State Auditor. Yeah, I think that there's no problem with coming back to share those follow-up results after we've gotten them in about a year. And as Sahara and John said, we'll also, this topic isn't going away. And whether it's a specific audit to focus on these particular communities or some other topic, I would fully envision that we'll continue to have many audits looking at the situation around homelessness. It's just obviously such a big and impactful topic that we need to keep looking at.
Thank you kindly. Thanks for being here, Scott. All right, any other questions or good of the order from anyone? In that case, I want to offer deepest appreciation on behalf of the legislature to the state auditor's office and the representatives of our local governments who appeared today. And with that, we are adjourned.